Dr. Hale from Beebe Medical Group, Beebe Family Practice Lewis, and I want to talk to you today about Medicare Annual Wellness Visits. These visits are an important benefit provided by Medicare for patients, and the visits are an opportunity to sit with your physician once a year and review your preventative care and medical history. It's a benefit that Medicare provides with no copay or charge. And it's a time once a year to sit and talk about things of concern to you, maybe in a visit where we're not concerned with other problems that we need to solve. These visits are provided annually to any patient who is covered by Medicare. And typically those are patients 65 and up, but some patients younger, patients with disabilities who have Medicare are also eligible for this visit. There's an initial welcome to Medicare visit typically on the 65th birthday, which is a little more comprehensive and offers some testing that are offered as a benefit for Medicare during that visit. Following that initial visit, there's a subsequent visit each year, which is a half hour to review any problems, concerns, and any suggested screenings for the patient. Many patients in these visits, because of the format, have the time to discuss problems that maybe there isn't time to discuss in other visits during the year. And there are a lot of preventative type things that we might discuss that are, if gone unnoticed, may result in hospitalization, visits to the emergency room, or increased complexity of problems. So the focus on the visit is prevention, and if we can keep the patient healthy, we can keep them out of the hospital, we keep them out of the emergency room, we've served the purpose of the visit. And that's our aim in these visits, is to find any potential future issue and take care of it before it becomes a problem. A traditional physical that patients may be used to involves coming in to the doctor with a full exam. The format of the Medicare exam is different. In the annual wellness visits, there's technically no required exam. The visit is really centered around sitting and focusing on a discussion of problems, treatments, potential problems, and preventative care. Typically, I will see patients for this visit once a year, and at a 6-month or some other appropriate interval, we'll have a visit where we do a little more exam, delve into specific problems. We certainly aren't prohibited from handling a problem during a wellness visit, and sometimes we handle a specific problem during a visit. I think you want to come to the visit prepared so that you get the most from the visit. And by that I mean ideally bring your medications to the visit. If that's not possible, at least a complete list, including supplements and over-the-counter medications. It's good to have a list of problems and concerns ahead of time so that things aren't forgotten. It's good to make sure that you're prepared to discuss any medical history of surgery, other things, or chronic medical issues that you may have a concern about, so that your physician or your provider is aware of that, and we can make sure we discuss it during the visit.